Inspiratory reserve volume. It is the volume of air which we inhale during the deep inspiration, apart from tidal volume, which is about 2,500 to 3,000 milliliters. Now, expiratory reserved volume. It is the volume of air which we expire after forceful expiration, which is about 1,000 to 1,100 milliliters. It is definitely less than inspiratory reserve volume. Now, what is residual volume? It is the volume of air remaining in the lungs after a forceful expiration, which is about 1,100 to 1,200 milliliters. It can't be measured by spirometer, means the volume of air which remained in the alveolar sac to maintain the particular size of alveoli. Now let's talk about the respiratory capacities. Respiratory capacities. It speaks about what is the maximum amount of air that we can inhale along with normal breathing. Inspiratory capacities. It is the total volume of air which a person can inspire after a normal expiration. It is tidal volume plus inspiratory reserve volume, that is 500 plus 3,000 equals 3,500 milliliters expiratory capacity. After a normal inspiration, what is the total volume of air that we can expire? It is tidal volume plus expiratory reserve volume. That 500 plus 1,000, that is about 1,500 milliliters. Functional residual capacity. Volume of air remains in the lungs after a normal expiration. It is an expiratory reserve volume plus residual volume. It is 1,000 plus 1,100 milliliters. Now, what is vital capacity? It is the normal volume of air which is important for breathing. Volume of air a person can breathe in after forced expiration. It is TV plus I RV plus ERV, which is about 4,000 to 4,600 milliliters. Total lung capacity. It is the total volume of air a person can accommodate in the lungs after a forced inspiration. It is VC plus RV, which is not in use, or TV plus IRV plus ERV plus RV, which is about 5,000 to 5,800 milliliters. Now we are going to discuss the exchange of gases. We know that gases will be across the alveolar membrane between the blood and tissue with the help of simple diffusion. And this diffusion is based on pressure/concentration gradient. Now let's understand, in the atmosphere, the concentration of oxygen is more, the pressure is more in the atmosphere compared to that of alveoli. However, there are different factors which affect this simple diffusion. Factors affecting the diffusion pressure: 1. Solubility of gases. 2. Thickness of diffusion membrane. 3. Partial pressure of gases. Now, what is the meaning of solubility of gases? In a simple way, what is solubility? It is the ability of gases to dissolve in the fluid. Compared to that of oxygen, 20 to 25% of CO2 is more dissolvable in plasma, means it shows better diffusion compared to that of oxygen. Another factor is partial pressure of gases. It is the pressure exerted by individual gas in the mixture of gases. Partial pressure of CO2 is nothing but it is the pressure exerted by CO2 in the system in the mixture of gases. Let's see how these gases are moving in our respiratory system.